Hi everyone. On behalf of Yashoda Hospitals, we are delighted to connect you with our doctors via Facebook Live. Today, we have with us Dr. Venkata Kola, a clinical director from Yashoda Hospitals, Hyderabad. Welcome, doctor. Thank you so much for being here.
Good morning. Thank you.
As COVID-19 pandemic has disrupted our lives, the world has come to a standstill. Workplaces are being shut, exams have been rescheduled, there's a travel ban, we all are working from home as well. While we deal with the crisis in the community at home and work, while also dealing with the concerns such as managing the health conditions of our families, friends, and ourselves, let's understand a few concepts about the COVID-19 situation. Doctor, thank you so much for joining here. Doctor, can you quickly take us through the symptoms of COVID-19?
See, the COVID-19 symptoms are not completely far away from the other common cold symptoms. The predominant symptoms, what we have seen with COVID-19 is high-grade fever, cough, and breathlessness. Other than this, we also see very few cases where the running nose, like influenza, like cough, and also we have seen some diarrhea, but they are all rare. These are the three prominent symptoms are high-grade fever, and then you cough, dry cough mostly, and breathlessness. These are the three predominants.
Okay, doctor, how can we differentiate between a common flu and COVID-19?
See, what pattern we have seen with the COVID-19 compared to that of influenza or a regular common cold is, in common cold, many of the patients starts with a kind of a influenza-like flu symptoms, like you have a running nose, sore throat, nasal congestion, sneezing, and mild cough, which actually gets better in maybe 3 or 4 days with body pains, myalgias, and all that kind of thing. Contrary to that, we see more COVID-19 cases starts with the fever being a predominant symptoms and followed by very dry cough. And many of them in a certain age groups and high risk groups are going into a pattern of breathlessness. So, we we do not see the in common cold and influenza the same pattern. The common pattern there is running nose, sneezing, and sore throat and all. But in the same way, COVID-19 also few patients may also present in that way. Like some of them have sore throat, some of them has sneezing, running nose, but they are rare. So when somebody is actually presenting with a fever and dry cough, I will have more inclination towards a possibility of a COVID-19, whereas somebody is having a running nose, sneezing, and more of a respiratory, upper respiratory symptoms with not much of fever and myalgia and all that, that indicates more towards a possibility that you are dealing with an influenza. But all said and done, any patient getting worse and getting into a breathlessness state should not take things lightly, because overlap do happen, even though we have seen this pattern.
Doctor, how long is incubation period for COVID-19 patients?
See, officially WHO and across the globe, the common official incubation period is given somewhere between 2 to 14 days. That's 2 week time where we actually ask people to isolate, quarantine and all. But all saying this, there are a period where a patient can be also asymptomatic transmitter. That's where we are more worried right now. The other possibility is that few of these patients after 14 days also carries this virus and can transmit. So that has extended up to 24 to 30 days also in few cases. So officially right now, many of us are following that 14 days deadline, but there is no rigid boundaries to that. People have shedded these viruses before they are symptomatic and much before the symptoms comes 2 days before in a symptomatic period. And also some of those after 14 days also has shedded, but we are trying to track down that number and percentage yet.
Well, doctor, is there any patient or recovered patient getting a chance once again the COVID-19? Are there any chances of getting it again?
Yes, that's a very actually $1 million question right now. We call it about a herd immunity. Suppose some patient got a kind of a coronavirus infected and he has gone through the illness and he recovered. So the question is whether he will get reinfected with the similar kind of viruses. We assume that there is a herd immunity which happens in many of the situations in SARS and MARS, and many of them had a 1 year of herd immunity. But with looking at the current pattern, we few cases where in even Wuhan in China, where a few patients who recovered also had a recurrent illness with a mild respiratory illness and all, they were not very clear whether it is a continuation of the same previous illness which prolonged, or it was a recurrent illness with some other virus, or it is a corona again or a COVID-19 again. So at this point of time, we believe that there will be some herd immunity, but we need more time to assure, because this is just a period of 2 months time. So just strongly believing that just I got a COVID-19 infection, so I am having a herd immunity which will prevent me for life may not be true. And we are also seeing some strain change. There is a lot of L and H variant. There is a lot of a strain genetic shifting, drifting, talking about all this happening. So there may be an alternative strain which may also infect. So at this point of time, taking things granted may not be right way.
Well, that's true, doctor. Doctor, I would like to ask you a general question. What can humans become infected with COVID-19 from animal source?
See, it started like that. If you honestly ask me, the coronavirus which we are dealing with is a zoonotic virus. It is not a human virus at all. So we call it spillover when an animal virus with some very close contacts actually spills over to a human being. So we call a spillover from animals to human beings. Now we have not seen our currently across the countries that animals has spreaded this and infected any humans. But if you look at yesterday, day before yesterday, we have seen a few animals in the zoo, both tigers and lions, pick up that call.
Getting
So,
infected, yes, doctor. And
so
doctor,
they
how
have been
long?
they have
Yeah.
been found to be positive, COVID positive, and they got transmission from humans who were actually carrying them. They were also positive. That means there is a possibility of a transmission from human to animal, and these animals will again a source to transmit us. So
Okay.
that possibility till recent times we were not considering, but in the last I think 48 hours, 72 hours, the information across from Singapore and also from US that there is a possibility that we may transmit. So in a standard flat instructions, we are now assuming that we should avoid direct contact with live animals, close contacts, and also hand wash, hand hygiene, respiratory precautions when we are dealing with any pet animals also. Because suppose you are symptomatic or asymptomatic, you infect your pet, and that pet gets infecting the others. So we need to protect that, because I think we may not have a concrete evidence at this point of time, but we need to be careful with the recent developments.
Well, that's true, doctor. Well, doctor, how long does virus survive on surfaces?
So that's again became a very big debate across. So if you look at the last 2-3 months debates, so if we are talking about transmission, not just with respiratory droplets, like somebody sneezing, coughing, that droplet going and infecting somebody when he inhales. There is also a very important percentage of population who got infected through vomitus. That is, somebody sneezes, coughs, and the droplet drops on the surfaces, and somebody touches them with the hand, and again getting into contact with their nose and ear. So the surfaces which we are talking about where this virus survives differs, like normal tables to inanimate objects to a humid areas and temperature. Somewhere initially we were thinking about it may vary up to 12 hours or so, but we have reports that it may extend beyond depending on the temperature and humidity. So right now we are more careful on disinfecting and avoiding any touching surfaces and all. So to be definite at this point of time, 12 to 14 hours is the time limit which has been given for a surfaces, but it varies. It varied a lot. There are a lot of studies coming up saying the virus can survive in many more things. See, we have seen this virus has been found in urine, it's been found in stool, it's been found in even genital secretions, and also there is a lot of ways it can excrete, and even in flushing of commodes and can be a source of aerosols. So in patients areas, we are recommending you should cover the commode before you flush, or take away yourself when you flush them.
Well, this is very confusing. Is COVID-19 airborne, doctor?
Uh, See, to start with, we believed that this is being droplet borne, and where from this concept came? This concept came from previous experience of coronavirus from MERS and SARS. But looking at its spread, the way it is being going in the R0 being 2.4 to 3, that means one patient infecting more than two or three in an average. So that is being a challenge, and a few of the situations where some of those reports have said it can be still an airborne. But at this point of time, across the globe, we are still believing that the COVID-19 is restricting itself to a droplet borne. But when we are going closer to these patients in the form of doing any aerolized procedures or any kind of maneuvers into the airway, we strongly recommend to protect ourselves with the airborne precautions.
Well,
Uh,
doctor, are children also at risk of infection, and what is their potential role in transmission of this COVID-19?
Yeah, initially in Wuhan, in China, when things started, there were believed that somewhere in the pediatric age group, less than 10 years, are a little immune or little resistant to any form of COVID-19 related serious illnesses, even though there were reports of infections, but there were not much serious. But contrary to them, in US, we have seen people in that age group, less than 10 years, getting infected, and also many of them are also getting into criticality, and we have seen few deaths also in this pediatric age group. So thinking that pediatric age group or children less than 10 are resistant or immune may not hold goods right now. So they are still at probably are equally risk population. But yes, at this point of time, we have not seen many criticality in them, but only pockets of information here and there are they are critical. Coming to, they can be asymptomatic carrier, as you rightly said. We have our clinical experience right now, where few of our known families who got into this virus, who traveled abroad and they came here and the families got infected. The wife and the mother and the father got infected. The children are also tested positive, but none of them are symptomatic. They were cheerful, they were playing, they were actually enjoying the life, but in the same time they were positive. That means there is a risk carrying that they can be a potential source of transmission to the adults. So we cannot deny that fact that children can be a carriers, and that to asymptomatic carriers.
Okay. Doctor, are face masks effective in protecting against this COVID-19?
See, across the globe, this question is been onto the tussle. Face mask is only recommended to those who have symptoms to prevent the infection spread from them to others, number one, and to all the healthcare workers who are in contact with the patients in any form. But right now, looking at the community spread or the public place spread, Indian government also and other areas across the globe also, they have started talking about using something to protect your nose and mask, nose and mouth, so that you do not inhale or you do not spread any infection. That may be like any napkins in the form which you actually hygienically clean and disinfect, or you may use any form of homemade masks in a public places, not at home, but maybe in a crowded public place where you keep a social distancing and something to cover your mouth and nose. And coming to the surgical mask, at this point of time, those who are not in close contact with the patient in the form of aerolized generating procedure, a surgical 3-ply mask is scientifically good enough. You are maintaining a meter distance or a 2-meter distance from the patients or any other person, should protect you from any form of this COVID-19 infection.
Well, thank you so much, Dr. Raman Kola, for joining with us on this show. Thank you so much.
Thank you, Sunita. Nice presenting.
Thank you, sir.